name is Dr. Damian Domanski, and I'm a cardiologist at Heart Center at Lone Peak Hospital. I specialize in general cardiology, which extends from preventive cardiology to treatment of most common cardiac conditions from hypertension, coronary artery disease, congestive heart failure, and valvular heart disease. Cardiovascular problems remain the number one killer in our society, and we're seeing many patients with coronary artery disease, patients that underwent stenting and bypass surgery. We're also seeing a lot of patients with congestive heart failure, but I would say luckily nowadays we're seeing more and more patients that want to prevent these things from happening and come early from screening and just to make sure that their heart is in a good condition. Between our clinic and hospital, we provide a wide spectrum of cardiovascular services that extends from outpatient exam to inpatient services, as well as screening and diagnostic testing, and also includes invasive testing as coronary angiography and stenting. The most common screening and diagnostic testing that we perform are tests based on the CAT scan, which can help detect very early stages of coronary artery disease, at which point we can usually prevent a heart attack and any serious complications, as well as different modalities of stress testing, both nuclear as well as based on the echocardiogram, which is the ultrasound of the heart. What I think is our strength is that we can see patients very urgently, which is incredibly important, especially in cardiovascular diseases. We see our patients mostly literally on the next day. I can tell from my own perspective that having worked for over 25 years now in multiple places, this is the hospital where I feel best, and I hear that from the patients as well. What makes our team special is that we provide full spectrum of cardiovascular services. We can see our patients quickly, and majority of testing can take place on the campus here, so it doesn't involve unnecessary traveling and outside referrals. My favorite part of my job is how much we can help our patients nowadays. I personally have witnessed in my 25 years of practice an amazing progress in the field of cardiology. In the last 10 to 20 years, we have seen amazing advancement in the stents that we are using, in many surgical techniques, especially treatment of the valvular heart disease, as well as advanced congestive heart failure. And this advancement allow me to help my patients so much more. And I find nothing more rewarding than being able to help the patient that I know 20 years ago would not have any options. So if you or your friend or family member has any cardiovascular symptoms or problems, make sure to call our office and we'll be able to help.